My name is Millicent Gorham, and I am the chairwoman and CEO of the Alliance for Women's Health and Prevention, or AWHP. For those of you who may not be familiar with AWHP, we work to advance policies to ensure equitable access to high quality, affordable preventive care for all women and girls. February marks both American Heart Month and Black History Month. These two observances provide us with a critical opportunity to uplift the importance of women's health and preventive care, and the ongoing needs to invest in measures that drive and sustain health equity. Today, we will be discussing the importance of accessible cardiac care and the broader role providers play in helping women navigate their screening and prevention options. For our discussion today, I'm thrilled to be joined by Dr. Barbara Hutchinson. Dr. Hutchinson is the chair of the board of the Association of Black Cardiologists, Inc., and president of Chesapeake Cardiac Care, headquartered in Annapolis, Maryland. She is a noted speaker on heart disease in women and how sleep affects heart health. Dr. Hutchinson serves as a fellow for the American College of Cardiology, a diplomate of the American Board of Internal Medicine, and was appointed to the Cardiovascular Examination Writing Committee for the American Board of Internal Medicine. Thank you so much for joining us, Dr. Hutchinson. Let's get started with our first question. As we commemorate American Heart Month and Black History Month, we want to acknowledge the disproportionate health outcomes of Black Americans face when diagnosed with heart disease. Can you talk about that?
When we think of Heart Month, we cannot help but recall the fact that heart disease is the leading cause of death in the United States in both men and women. However, it is no surprise, like you stated, that February is also Black History Month because heart disease disproportionately affects Blacks. It is said that race-based disparity is the leading cause of death among men and women less than 65 years old. And if we take a look at some of those risk factors for heart disease, the biggest one being hypertension, Blacks are 4 times more likely to have hypertension than whites. And because of that, we find that Blacks have a higher burden of morbidity and mortality from hypertension-related complications, which they tend to develop earlier in life than other ethnic groups. When we look at Blacks, we also see that they have a higher percentage of left ventricular hypertrophy or thickness in the heart muscle compared to whites. But you know what? Despite all these, the effectiveness of cardiovascular interventions, when we look at Blacks or adults, Black adults versus other ethnic groups and those that are in low economic groups, we find that Blacks are also less likely to have these interventions. And even if they do, they have poorer outcomes. So I totally agree with you that Blacks are disproportionately affected by heart disease.
So, what screening options for heart disease do women have at their disposal? And how can we empower women to seek out timely heart health care and screening?
There's several screening methods, but I always like to start with the obvious, and that is first having a physical examination that can be provided or performed by a primary provider. And be sure as part of that examination, obviously, the provider is going to screen your vitals, and that includes your blood pressure. It includes your heart rate. They may do a battery of tests looking at your kidney function, your liver function, your cholesterol level, your blood glucose testing. So all those as far as your physical examination or your annual physical, that includes the examination and blood testing. That's the basic. That could determine, do you have a chronic illness or do you not have a chronic illness? Going on from then, there are certain non-invasive testing that can give us further information. An EKG, which gives us an idea of the electrical activity in the heart. Do you have an abnormal rhythm in the heart that you may not have known about or don't feel? Then there is an ultrasound that you can get of the heart that could tell you a little bit about the heart valves, the heart function, the chamber sizes. All this information can help in terms of helping to assess what your risk of developing heart disease is. And it's so important for us as women who run families, we take care of everybody else, the spouses, the children, the extended families, the parents. Like I always say, we must first put on our oxygen mask before we can help others.
Throughout the conversation, we have talked about the importance of screenings and preventive care. What can patient advocacy groups do to better support equitable access to preventive care?
I would encourage them to continue to have a voice. They need to continue to emphasize the need for increased access to care for patients. It's interesting, insurance companies often don't pay for preventative care. You could have a calcium score done that could help risk stratify cardiovascular or atherosclerotic disease in patients, and that test may cost $100. Many insurance companies don't pay for that, but they will pay for you to have a night in an intensive care unit that costs $3,000 after a heart attack. So just rethinking or reshifting resources. Could it be if you pay for preventative care, that may avoid you on the back end paid for a $3,000 night visit in an intensive care visit. So I think advocacy groups need to continue to advocate for quality care, increase access to care for patients.
Dr. Hutchinson, this has been a wonderful conversation. Before we close out, do you have any final thoughts?
As we think of Black History Month, as we think of Heart Health Month, I think it's important for African Americans to take stock and recognize that without good health, we only have plans that we cannot execute on. And so it's important for us to be proactive with our health, getting regular checks with our providers, and addressing risk factors head on. And that included in that risk factor, I would say, is sleep. Be your own advocate and be a part of your care team.
Absolutely. Thank you so much again, Dr. Hutchinson, for joining me for AWHP's latest Fireside Chat with women leaders in medicine. I really appreciate you sharing your time and wonderful insights with me and our viewers. Thanks to everyone who tuned in. We encourage you all to learn more about the Alliance for Women's Health and Prevention at womenshealthandprevention.org. Thanks again. Look forward to seeing you soon.